Hi again. So for this video, I just want to, again, I'll keep saying this. These videos are meant to enhance your critical thinking. So it's a supplement to your textbook. It's a supplement to your videos that are in your course, and this is just to spark and enhance your critical thinking. So let's look at triage when it comes to burn. How do we triage patients when it comes to burn? So it's not every burn patient that will probably send to the ICU. So we'll be able to triage the burn to see who goes to the ICU and who goes to the regular floor. Okay. So number one, some of burns that we start sending patients to burn unit with burns that, like, we start with second degree, third degree, and fourth degree. So depending on the severity of these degrees of burn, or these stages of burn, second degree, third degree, and fourth degree, depending on the severity, your patient may end up in ICU. If it's a first degree burn, remember, for a first degree burn, this was just superficial. Superficial just means just the epidermis, just the top of the skin, maybe just redness and all of that. The skin is still intact. With that, we can manage that easily, and it's just less painful and stuff like that. But when we get to the burns that are seriously painful, which are second degree, most painful burn, your third degree is less painful, your fourth degree is zero pain, because all the nerves and the tissues, those have been affected. So this will be the patients that will consider to send to the burn unit and stuff like that. Also, vulnerable population. Your vulnerable population are your children, okay, children, and then the elderly population. So I think your textbook is talking about the ages 49 and greater. So 49 and greater will consider them under uh, though so adults, older adults, and children. Okay, vulnerable population, older adult and children. So age beginning of 49 above, and then they must meet the criteria of second degree, third degree, and fourth degree. They will qualify to go to the burn unit. Also, burns that involve the face, just like facial burns, hands, feet, face, hands, and feet, and then the genitalia or the perineum. Those burns too will go to the burn unit. And then electrical burns will go to burn unit. And then even burns that partial thickness burn, uh greater than 10%. Okay, greater than 10% partial thickness, those also qualify for burn unit. And then finally, I've mentioned children, I've mentioned elderly population, partial thickness greater than 10% of the body surface. So if the burn is greater than 10% of the body surface, they'll go to burn unit. In subsequent videos, we'll see how we'll do the Parkland formula, and then the rules of 9 when it comes to burn. That will be a separate video. But this video was just to enhance your reading, when as you're reading, just to know that there's some certain degrees of burn that will stay in a regular unit, and then there are others that will go to the burn unit. Okay, so just again, for emphasis, second degree, third degree, and fourth degree burns, they qualify to go to the burn unit. Vulnerable population like children and the elderly population, or any patient that is greater than 49 years old, they'll go to the burn unit with these degrees of burn. And yes, so yeah, so these are how we'll triage who goes to where and when. Then electrical burns, to we want to send to the burn unit. A burn that the body surface is greater than 10%, we want to send to the burn unit. And yes, I think that should cover most of it. That should help you as you study, you practice you study for your exam one. Those will be of help. So for 4th-degree burns, right, let me just mention this. For 4th-degree burns, which those are the most severe burns, maybe the only option for your patient will probably be a graft. They want to graft the area. And if they are grafting the area, as a nurse, just make sure if you're touching the graft site, you're sterile. It's a sterile thing. Just stay sterile when you're touching the graft site, and prepare it. If you're changing dressing and all of that, just make sure that you stay sterile. You don't want to introduce any bacteria into that site. For second degree burns, since I'm mentioning a little bit of treatment, for second degree burns, the best kind of treatment for this, because second degrees are blisters, right? The blister can be ruptured or intact, it's still second degree. So the best kind of treatment for this will be hydrocolloid dressing. Hydrocolloid dressing has a moisture retaining agent in it, which helps. They want to keep that burn, they want to keep it in a moist environment, because what the moist environment does is that it helps to remove necrotic tissue. It facilitates the removal of necrotic tissue. So they like that moisture retaining dressing, which an example is hydrocolloid dressing. A big complication for third degree burn will be development of hypertrophic scars. Okay, what are hypertrophic scars? Hypertrophic scars are just like excess collagens and during wound healing process. So these scars, they can prevent or limit range of motion. So again, if you have that concept in mind, that a complication for a third degree burn will be this formation of hypertrophic scars. If a patient has a hypertrophic scar, it will limit their range of motion and all of that. You know, once you don't use a lymph, you lose it. So if a patient has sustained a burn to the arm, then hypertrophic scars has developed around this area. So if we don't help them with range of motion, they might lose that that limb, the functioning of it, because it's not being moved around and stuff like that. So just thought I should mention triaging when it comes to burn. Who goes to the burn unit and who goes to the regular unit. Just be mindful that your stage 1 burn will not be a burn that you want to send to the burn unit. You start from stage 2, 3, and 4, and then your vulnerable population, which we mentioned children, we mentioned older adults, and then also with patients that are 49 years and greater. Electrical burns, patients that have sustained some kind of electrical burns. Oops, I went up to 7 minutes. I was trying to be mindful. Okay, I'll see you guys next video.